Hello and welcome to this special show. We are here to take your questions on coronavirus. You can call us on the number that's up on your screens. We have three special guests this evening with us. Dr. Dodal Mondal, radiation oncologist of the Apollo Hospital, is with us. We'll also be joined by Dr. Ravindra Khaiwal, public health expert, and Dr. Anant Mohan, the HOD of the Pulmonary Medicine Department at the All India Institute of Medical Sciences. Let's get straight to our callers. We have Salfia from Moscow calling. Salfia, what's your query?
Yeah. Good evening, NDTV. Good evening, respected doctors and viewers of India. I wish you a very happy Doctors' Day. This is Salfia from Moscow, and I belong from Kashmir, India. I am a final year medical student. My concern of calling is that people being put under quarantine in India are being placed under the same roof and inside the same rooms. What if the other person is being captured, is the carrier of the virus, and what if you get infected by that person because you want to stay with them for the next 14 days, yeah? Why they just don't isolate them in different rooms if it's possible? I mean, this way they're letting it reach to more people. So how are they going to get the grips with it? So this was my question. Now, I would want to add something else to this that could be really helpful for most of the people walking outside or working in this day of time. Now, it's really important to cover your eyes and hair as well with something because you never know who is carrying the virus. And what if they spit the sputum while passing by and the weather is windy already and the virus could stick to your hair and could go inside you via the eyes? As the virus is always in search of some host for its survival. Thank you.
Right. Dr. Mondal, would you like to take that query?
So, if I get that correctly, it's like the question is how to segregate people in the home.
Yes, in quarantine.
Yeah. So, as per my knowledge is concerned, the person who is showing the symptoms has to be kept in a separate room with minimum possible physical contact with rest of the family members, and if possible not at all.
And what about people who are being quarantined or are being kept at hospitals? Is there a threat of people contracting a virus if, for example, a person is not a carrier of the virus, is put in the same ward as the person who has the virus?
Yeah, so if you see the layout of beds in a hospital, usually it's always maintains a safe distance. So if the persons remaining in that quarantine facility themselves maintain that safe distance policy, I really do not think that putting them in a room would increase their risk, because the physical distancing of 1 to 2 meter is what is important. And the hospitals, I know, they mostly maintain that safe distance.
All right, we have another caller. Muzaffar is calling from Srinagar. Muzaffar, go ahead with your question.
First of all, let me salute my country for executing such a splendid way of lockdown, which itself is this example for the rest of the world. Now, as far as my question is concerned, if somebody tests positive for the coronavirus, hello?
Yes.
Yes.
If somebody has tested positive for the coronavirus and he has been hospitalized, after recovering from the coronavirus, and he is left at the home. Now tell me what sort of impact it will have on his immune system in fighting the diseases which may come during the rest of his life.
Dr. Mondal?
Yeah, so it's a very nice question. So which basically asks the possibility of acquiring immunity once the person is getting the infection.
Yes.
See, worldwide, all scientists are currently working on that, whether a person gets complete immunity once he is acquiring the infection. There is some data to suggest that few persons, after getting released from the hospital, are getting a second infection. So it's not yet known whether this infection gives complete immunity or not. Second question, the second question is, can you please repeat the second question?
Muzaffar, go ahead with your second part of the question.
My question was, once he is discharged from the hospital and he is fully recovered,
yes,
will his immune system
All right, so Dr. Mondal has answered.
So I already told
yes.
that. that scientists yet are working on that to understand whether one infection gives you lifelong immunity or not.
Yes.
Secondly, see, most of these viral infections usually give you an immunity of 2 to 3 years hardly. Now, the scientists are yet to know whether the same logic, whether the same thing happens with coronavirus or not. It's hardly been 3 or 4 months people are experiencing this infection, and it's very difficult to answer all these questions right now. The best suggestion at this moment would be, even after getting discharged from hospital, try to maintain all these safe hand hygiene practices. Keep washing your hands as much as possible, and whenever you touch your face, nose, or eyes, and maintain physical distancing.
Right. Right. We also have Dr. Ravindra Kaiwal, a public health expert, joining us via Skype. Thank you, Dr. Kaiwal, for joining us. I wanted to ask you, as a public health expert, when do you think we are likely to hit a peak in this pandemic as far as India is concerned?
If you look at, there are various scenarios, but after the lockdown, basically, we will see how the situation occur. But if we go through this will be mid of April and most commonly approaching by the end of the April. So there are various scenarios. Even if we continue lockdown for extended period, how it will behave. So it is too early to comment at this moment.
Too early to comment. Piali from Mumbai is calling with her question. Piali, go ahead.
Yeah. Good evening, Rohit, and good evening, doctors. I am going to split my questions into two. My question is, this 21 days lockdown, being into medical fraternity, would this be sufficient? As a specialist, can you help us to know to curb down the positive cases in India? This is number one. And if it does not get extended beyond 21 days, what would India see as a prospective risk to combat this deadly virus?
Dr. Kaiwal, would you like to take that?
Okay, look, there are three scenarios. Number one, which is looking at that if we don't have a lockdown and there will be a peak and then it will be surged very fast. Another one are like mid and means if we have this lockdown, then this will be a flattening of the curve. Flattening of the curve means nowhere the cases will be down, but we will have time to prepare ourselves. Of course, we are aware of the situation since the beginning when it was first reported in China, and we are preparing hard. But at the same time, we have to prepare at the, you can say, ground level and even up to rural area. So we are working in this direction, and based on this scenario, basically this lockdown was prepared. So it all depends how the policymakers are taking it up. And probably, as declared, as announced today by the Health Ministry, after 21 days, probably they will make again the situation analysis, and based on that, they will decide should we go ahead or should we complete this lockdown period.
All right. I also have one question, doctors. If Dr. Mondal can take that. The disinfecting yourself, whether you are a medical professional or people like you and me who are working in essential services, is very crucial. Can you tell us what is the standard disinfecting protocol for medical workers and for everyone else who's working in essential services, Dr. Mondal?
So right now, if you see the site of DGHS, Ministry of Health and Family Welfare, they have in a very crystal clear manner, they have categorized the risk, the low risk, high risk, and moderate risk. So depending on that, they have also mentioned the kind of protective equipments one should use. There is as such no generalized way to disinfect someone. What we try to prioritize is safe hand hygiene and facial hygiene. That means washing hands with soap and water at least for 20 to 30 seconds, or rubbing the hands with alcohol-based solution at least for 20 to 30 seconds, and then before and after touching every object. So it may be some surface of the hospital, surface of tables, or even touching your own body parts like touching your face, touching your nose, touching your eyes.
Yes.
It's better to avoid all these things. And if it is inevitable, sterilize your hands before and after that. Second important thing, people are wearing masks indiscriminately nowadays, even when they are actually not requiring that. But what can happen inadvertently, and when the person is not that much conscious, hands always go to face and people touch that mask, and
Yes.
that can be actually more risky to get the infection. So it's better to avoid that practice, or if at all it is required to touch the mask, always sanitize your hands before and after that.
Right.
So,
Right,
now
Dr. Mondal,
regarding
we have another caller.
yeah, yeah.
We have another caller. Zaid is calling from Delhi. Zaid, go ahead with your question.
Doctor, I have a question that is it safe to have non-veg during this COVID-19, as there are many rumors that this disease transmits through the animals also?
All right, let's introduce Dr. Anant Mohan here, HOD of the Pulmonary Medicine Department at AIMS. Dr. Mohan, would you like to take question whether it is okay to have non-vegetarian food?
Well, yes, it is because although the starting point was from a animal market in China, that is true. But then our culture is different, and there is no evidence that the food habits has any bearing on the transmission of this illness as of now. So the primary mode of spread, as everybody has told, is by droplet infection and by droplets on surfaces. So either through transmission from person to person is there. And especially the only thing one can say is that it is always better to have the food well cooked. So if one is having non-vegetarian food, have it well cooked, and I think then one would be okay about that.
Dr. Mohan, we've been reporting that there is a critical delay in the delivery of the personal protective equipment. In fact, what the government has ordered, not even 10% of PPEs have been delivered. How crucial is the personal protective equipment for medical personnel like you and the health staff dealing with the corona cases?
Well, it is crucial, of course, especially for people who are in the business of directly dealing with the patients of corona or suspected corona. So the only thing is that the personal protective equipment is, there are various stages or layers of it. So most of the healthcare workers only need the aerosol and the hand hygiene or barrier protection. And then there are the heavy personal protective equipment, the one that covers the head, the face, the entire body suit and everything with the double layer gloves and goggles and or eye shields. So that is the one that is required for those people who are directly in contact with positive patients in physical contact or directly taking care of them. So it is useful and it is essential, of course, to that level. Now, every healthcare worker at every part of the hospital does not require the same level of PPE. And there have been certain guidelines made regarding that who needs what. So there are some broad guidelines available. So N95 mask, for example, is not required, contrary to popular belief. It is not required for everybody for protection against COVID. So a casual health worker working in the wards or who's not directly in contact with patients may not need it. Right. So a simple surgical triple layer surgical mask is good enough to protect against the aerosol transmission of this virus. So it is required, it is essential.
Yes.
The degree to which it is required depends upon how close or how proximity you have to the particular patient.
All right, we have another caller. Huzaifa is calling from Srinagar. Huzaifa, go ahead.
Hello, good evening, sir.
Yes.
My query is about the food we purchase from the market, the eatables we purchase from market. How can we assure that the food we have in our hand is safe to take home, or we have to take some measures before using that?
All right. Dr. Mohan, can you take that question? Do we have to disinfect the groceries, the food items we purchase from the market?
No, I don't think so. I mean, the only thing is that, again, the wash it well, wash it well, cook it well. I think the same principles apply, the same practices apply for this as well. So I don't think nobody advocates disinfecting food stuff. You can't do that. So the only thing is just buy the food, just wash it well, and cook it well. I think that should be enough.
Right, Shifali from Mumbai is calling with her question. Shifali, go ahead.
Hi, good evening. Just with the whole onset of corona, there have been a numerous number of animals, pets that have been abandoned on the roads, as well as a lot of the streeties. I would like to know, is there any chance of these animals transmitting any sort of infection to people, which is why they've hit the panic button?
Dr. Khaiwal, is there any danger of animals, pets infecting people with coronavirus?
No, basically we have to, as my colleague mentioned, we have to maintain basic hygiene. So if we handle with our pet, we need to wash hand properly, and whenever they come in our contact, we need to wash. Yes, there are some evidence, 1 or 2 pets where it is reported, but there is no other major reporting regarding that. Yes, it is spreading in the through the pets basically, and hence those who are leaving their pets, I will simply request them, please maintain the proper hygiene whenever you come in their contact, and then it is no need to be worried.
All right, we have another caller, Simranjit from Bharuch in Gujarat. Simranjit, go ahead.
Good evening, sir. I wanted to ask, sir, we have given ample stress about sanitizing our hands and washing them again and again. But what I see, we still are not stressing to disinfect the objects that we are holding, like ball pens or keyboards, which can infect our hands again and again. So what are the materials that should be used to disinfect the surfaces in our office or public places, sir?
Dr. Mohan, would you like to take that?
Yeah, so again, that's an important question, and the simple substances may be again like alcohol-based rubs, alcohol-based solutions, or it may be simple hypochlorite solution, that is a bleach which can be prepared, diluted. 1% bleach solution can be used not just on keyboard but on all surfaces, and actually one should clean the handles, the areas where one is touching very frequently, especially in households where you might be having a suspected patient, or the family might be in quarantine or isolated. Especially in those areas, for protection of other people, one can very easily wipe all these surfaces, all the table surfaces, handles which are frequently touched, by hypochlorite solution or bleaching powder, which is domestically quite easily available. So that would be a pretty simple solution.
All right, we have Harun from Chennai calling. Harun, go ahead with your question. Harun, can you put your television on mute and ask the question, please?
The passengers coming to the Gulf country.
Harun, can you hear me?
Yeah, I can hear you.
Yes, please go ahead with your question.
Yeah. Good evening.
Yes.
I have a question. The passengers coming from the Gulf countries and landing in Kerala all are infected with the coronavirus. And there is no symptoms when they are boarding the flight to the Gulf country. And
Arun, I'm sorry, I have to interrupt you there. Your line is not clear. We'll try and take your query at some other time. I'm afraid that's all the time we have on this show. Thank you, Dr. Mondal, Dr. Khaiwal, and Dr. Mohan for joining us and taking our viewers' queries. Thank you very much for joining us. Goodbye.